I'm Bailey Medeiros, Director of the Roanoke Valley Collective Response. Today we're talking about the power of peer recovery work, why these relationships matter, how meaningful support changes outcomes, and the role the Peer Recovery Network plays in strengthening recovery across our community. I'm joined by Dr. Kim Horn and peer recovery specialist Brian Bailey to explore why this work is so essential. All right, can you each tell us about yourselves and the work that you do?
So my name is Brian Bailey. I'm a certified peer recovery specialist. I work at the Hope Initiative at Bradley Free Clinic. Pretty much am able to help others and guide them in their path of recovery, whatever that looks like for them, and connect them to different resources in the area.
And how long have you been a peer?
I've been a peer for about 4 years now. And I had a mental health casework background, and I decided to go into the peer field to not only strengthen my own recovery, but to help others kind of strengthen theirs as well.
Awesome. Dr. Horn.
Yes. I'm a research psychologist, and I've been in the field of substance use disorder and addiction recovery for about 30 years. I've been studying peer recovery support more recently and the importance of human connection in that work.
Brian, for folks who might not be familiar, what is a peer recovery specialist and what do they do day to day?
So a peer recovery specialist is a person who has lived experience with substance use disorder or mental health challenges, and they are essentially a mutual guide in assisting others in their path of recovery. A lot of peer recovery specialists have that lived experience to kind of bounce back off of and can help somebody kind of find what they're looking for as far as different paths. So it can be, 12-step, it can be medication-assisted treatment, all different pathways. They kind of are just a person that advocates and helps that person alongside their recovery and determine what recovery path they want to take.
What can be challenging about that work?
In my experience, it's definitely been finding time for self-preservation and for self-care. Naturally, as I've been through my own personal recovery journey, I found that I really value being that person to help others, but it can also be a downfall because then I'm not able to check myself to, take a break or overextend myself. So I'd say that can be a big challenge, is just having that time set aside for self-care.
Dr. Horn, in your research and your experience, why is something like peer recovery such an important, valuable part of someone's recovery?
Yeah. 3 reasons come to mind. One is that this work is so essential because we bring lived experience to the table. And we know that people learn best when they see someone is like themselves. And the research demonstrates that. And the second reason is that, people need to be able to feel like they're seen and heard and understood. And I think people who with lived experience bring that to the table. And we know that when people can let their guards down and feel more accepted, that change is more likely to happen. And I think the third thing that a lot of people don't realize is that peer recovery specialists receive intensive training. They are certified. So all that taken together increases the likelihood that someone can change and get to a place of recovery. I think as much as anything, peer recovery specialists give hope that change can happen and they're not alone in it.
So in our region, we have the Peer Recovery Network, where peers can get together monthly and support each other professionally and personally. Why might a network like that be beneficial to a person?
Well, I'm not telling you all anything you don't know. Peer recovery, peer specialist work is hard work. It's emotionally taxing. It's draining. You give your time, your energy, your heart, your compassion, and that needs a place to refuel. And a peer network gives peers a place to do that because they're with other people who understand what their day-to-day looks like. other people who get it. And I think peer networks are such a critical investment for the long-term sustainability of peer work in our community.
Brian, you're a super important part of the peer network. How has it supported you?
I'd say it's always a good place to feel refreshed that other people understand where I'm at, as far as, compassion fatigue or just different things that come with this type of work. It also is a really good opportunity to network with other people, learn some professionalism skills. I know when I first got into the field, I didn't even know how to write a formal email, and bouncing those ideas off of others who may have been in the professional light can be beneficial. So it's really helped me a lot, just networking with other peers, seeing how their organizations treat them, because there can still be a stigma attached to peer recovery specialists. So it's always good to have that camaraderie of other people that are in the field.
Does your research echo that?
Certainly. And I think one of the most important things about what you said is that need to relate to others, because burnout is high among peer recovery specialists. So having that network, the research shows that having that network of people who see you and understand what you go through is essential for reducing burnout. I mean, the more connected we are in all parts of our lives, the healthier we are, and particularly in jobs where the burnout risk is high.
I want to repeat that. The more connected we are, the healthier we are. Will you say more on that?
Yeah, I mean, there's more and more research. The research is indisputable now that connection is like, it's a vital sign. It's like, it's like thirst, it's like hunger, it's like sleep. We need it to be healthy. And, I think when people, especially when people are walking the path of recovery, there are so many trips and barriers and triggers that can cut us off from people and places and situations that feel familiar and comfortable. And peers in the network bring that sense of connection back to people that they have often lost.
Dr. Horn, you called connecting and relationships a skill. Why is working on that skill so important?
Yeah, I mean, when you think about the things that we think about in terms of social skills, communicating effectively, listening, expressing our feelings, those aren't things that always come naturally to people. But if we practice them like they are a skill, I mean, if you practice something, you get really skilled at it, it just becomes a part of who you are. So communication is a skill. Starting a conversation is a skill. Writing an email professionally is a skill. All these things are skills, and I think that we all need a tune-up every now and then.
Yes. Well, we got a great tune-up today with your training. Will you say a little bit about the book I'm holding?
Yes, Friends Matter for Life, Harnessing the 8 Tenets of Dynamic Friendship. And in the training today, I went through those 8 tenets in the context of peer recovery work. And those 8 tenets create a framework of how we navigate the ins and outs and ups and downs of our relationships, and how we bring quality to those so that we have high quality connections. The book really came, it came as a part of our pandemic times. A lot of my research shows, it doesn't matter what I've studied, be it addiction, mental health, exercise, diet, whatever the health outcomes I've studied, the degree with which we are socially connected impacts all aspects of health.
Wow.
So I wanted to, instead of another academic paper, I wanted to write a book that could be read by the masses that helps people understand why connection is so important to our health and how to do it.
You have maybe heard this in your own recovery journey, but I'm thinking of that quote, the opposite of addiction is connection. Yeah. And that feels really true in this conversation.
Absolutely.
I'm so grateful we had this conversation. Thank you so much. Dr. Horn, how can people find out more about your book?
Yes, for all things about the book, to purchase it, to learn more about it, or the work that we're doing, drkimberlyhorn.com.
And to become involved with the Roanoke Valley Collective Response, visit rvcollectiveresponse.org.